10 pounds, you're taking away 50 pounds of pressure to the joint. Doesn't mean that the joint that is already worn down and is vulnerable like this is going to open up and take the pressure away, but just the pressure that is being applied with the extra weight is released by just losing the weight. Patients who have mild arthritic changes, we normally start them on topical creams, oral ice, lifestyle modification, followed by natural products. There's a lot of people who ask me about chondroitin, glucosamine. Those are type of over-the-counter vitamins, I will call them, or supplements that they haven't shown to have any scientific backup. There's always been not a concrete result on how they work. But I have patients who use it and they love it, and I have other ones that take it and then nothing happens, but they still take it just out of precaution. Natural stuff will be honey, turmeric. Turmeric, you can even put it on your meals, or you can buy it in a form of pills. There's also ginger, and there's also tea. Actually, I was talking to a patient earlier that uses a tea that is honey, turmeric, and ginger all together. And she swears by it. She says that she has great results. So definitely something that we can try. Other conservative treatments is bracing. Bracing, I normally start my patient with just elastic brace. It's very comfortable. Most patients tend to buy it over the counter. Bulky braces, they tend to sit on patients' closet most of the time. For the patients who have very severe deformity, either valgus or varus, we use a type of brace that's called an unloader brace that takes some pressure away from the joint. Some patients are able to tolerate it, but other patients, due to the pressure that the brace is causing, they tend to not use it anymore. Assistant device will be cane, walkers, or crutches. So if you're having pain, I'd rather for you to use one of these devices rather than holding on to your grandkids and walking around, or especially if you don't have anybody near you, I'd rather for you to use a cane or a walker, because a fall will cause other catastrophic events. Injections, there's multiple type of injections. Cortisone is normally the ones that we have available here in the office. We can do it right away, especially for acute flare-ups. We have normal cortisone, and we have another one, long-acting cortisone, that just started in the market not too long ago, that we have been giving it a try. There's also hyaluronic acid. In the Spanish community, is more basically called cresta de gallo, or gels. So people misunderstand the portion of the hyaluronic acid. They think that the gel is going to make a cushion, is going to create a good space in between. And what the hyaluronic acid does is bind to the synovial fluid, give it a more viscosity. The more viscous it is, the theory behind it is that the less friction or the less pain that they're going to have. We also have platelet-rich plasma and stem cells and amniotic fluid. This type of injections tend to have anti-inflammatory process that can help with the pain, inflammation, and they might potentially have some healing process. However, they're still under investigation on the healing portion part. We see better results in these injections where there's mild to moderate arthritis. If anybody's interested in performing these injections or would like more information, you can come and see me. I can set you up with Dr. Schwarzen, who provides those injections here in our practice. The typical ice and heat is normally I tell patients to use it for 10-15 minutes, no longer than that. You can do that multiple times a day. Physical therapy. Most people, they don't know how to exercise, and they may go to the gym and they may start doing some sort of activity just by looking at their neighbor and see, okay, they had the walking machine at an incline of 7, let me just put it there, and they end up getting hurt. So physical therapy gives them a better program for strengthening, balance, and proprioception. Patients who have arthritis, I normally recommend low-impact exercise such as biking, swimming, walking, lightweight training, yoga, Pilates, and Tai Chi. Other type of treatments is acupunctures. Acupunctures are always used in combination with this type of scenario. Patients may find this beneficial as well. Again, it's not something that I promote There's not really a science behind it, but there's always option of using that. So results, most people may have temporary relief. The study that I had talked earlier saw possibly between 5 to 7 years of non-surgical management for these patients, and 50% of them did not require surgery, and they were able to get back to their regular activities. Now, the goal is not to have your knee or your hip back to where you were 18 years old, but to be able to live a comfortable life, to be able to do your activities and be comfortable. Unfortunately, there was also a group that did not respond well to conservative management. Those were patients who were in the a little more than moderate to advanced and end-stage arthritis. Those patients, even if they tried conservative management, they ended up in surgery, which is not a bad thing, but the whole goal is to try to give you a better quality of life, whether it's surgical versus non-surgical. Most patients may improve about 40 to 80% depending on the severity of the arthritis. So the more arthritis you have, the less effective the treatment may be. And on occasions, no relief. That's most of the times on end stage. People ask me about narcotic medication, opioid medications. We do not treat anybody with opioids. That cause dependency, may cause confusion, and they become active. So addictive, I'm sorry. So we do not prescribe any narcotic medications for conservative management of arthritis. Alana, you wanna address the question? Because now we get into the surgical management.
Yeah, sure. So you kind of touched on it a bit, but it says, how do you feel about plasma injections to the knee? Can you explain the injection to the knees that is called chicken crest injection?
Okay, so the chicken crest is the cresta de gallo hyaluronic acid. Just like I mentioned earlier, there are a bunch of different companies that have this type of injections. They come in a series of 5, series of 3, series of 2, and a 1 injection. Normally I go based on what the insurance company plan covers in order to provide this injection to the patient. Has seen good results with the 1, the 2, the 3. I don't really use the 5 injection anymore, but within those I normally use them. Again, this is tailored to the patient. Sometimes I inject hyaluronic acid and patient feel great. Sometimes I do cortisone and they don't do as well, so I just move into the hyaluronic acid or vice versa. In terms of the platelet-rich plasma, we Dr. Swarson, who does this procedure, he takes the blood, your own blood, treat it, centrifuge it, and then inject it back into the joint. That has healing effects. The platelet-rich has healing effects or anti-inflammatory effects that reduces pain and inflammation secondary to the arthritis. Again, we can have a further conversation of this. If it's something the person who asked the question is interested, we can definitely address it. Okay. Hope I answered that question.
Great. And then you touched on this also, but if you want to go more in depth, it says, please advise on the importance of exercise if you suffer from arthritis of the back.
Okay. So arthritis of the back is one of those conditions that I don't really get to see much. I normally have Dr. Mena address those. But people who have back conditions, depending on the amount of arthritis, they may find it challenging to ride a stationary bike or to walk. Some arthritic changes may lead to spinal stenosis, which will cause weakness on their legs. So normally we address the back issues with core strengthening and exercise, lower extremity strengthening. But basically, I have that be managed more by Dr. Mena and his team, or Baptist Spine Center, or Baptist, Main Baptist.
Okay, perfect. And then one other quick question. Can a TENS unit be used on painful joint?
Okay, so yes, the STEM unit has different settings. Most people may find some sort of relief applying the TENS unit that stimulates muscle, that stimulates circulation, and helps with that achy joint. Now, we don't put it directly in the joint, but we put it on the muscles above. So if it's in the thigh, this is the knee. So most of the sticky pads will go above in the quadricep and below the knee. So the electricity will cross within the knee itself. Stimulating muscles, that's why we ask you to exercise. That doesn't mean that patients need to be 24 hours in a gym or spend 3 hours walking. This is tailored to the patient. So I'd rather for our patients to do an exercise activity, let's say an example, walking for 15 minutes 3 times a day, rather than trying to walk for 30 to 45 minutes once a day and then spend 3 or 4 days with the knee elevated in pain and very sore. So the best way to address physical activity is based on your symptoms and your limitations.
Perfect. And